Now it is my great pleasure to turn the Zoom stage over to MK Czerwiec, who is also known as the comic nurse. MK is going to do an interactive workshop, and we're going to ask you all to participate actively in the chat. MK is a nurse, a cartoonist, and an educator, and a co-founder of the field of graphic medicine. And she said that, as she said, I am a nurse who uses comics to reflect on the complexities of illness and caregiving. And this presentation is entitled Graphic Medicine, Drawing Our Way to Collaborative Care. Thank you, MK, and welcome.
Thank you very much. It's such a thrill and an honor to be here, and I've so enjoyed this consortium thus far, and thank you for inviting me to be here. I am going to share my screen, and I work in a visual medium, so I've got a lot of visuals here. But I'd like to invite you before we start to be very involved in the chat, drop any comments and questions. And one of the advantages of being in this format is that we can have access to our thinking as you're thinking it. And I've been really enjoying watching the chat and the feedback as this entire consortium's gone on. Right, so this is my my elevator pitch. First, I thought you'd tell you kind of who I am and what I do so that you get a feel for kind of where I'm coming from. I'm a nurse who uses comics to contemplate the complexities of illness and caregiving. And the word uses there is doing a lot of work. It kind of refers to the fact that I read comics. I'm reading graphic novels by people living with illness and caregiving and disability. I teach with them. So I teach medical students and nursing students and basically every aspect of that you can imagine of all of us who come to give and receive care. And I make comics. I'm a cartoonist myself. So, yeah, sorry, my slide here. This is kind of my mission statement. My work attempts to use the medium of comics to help make challenging situations somewhat easier for patients and families. And as a nurse, you know, we see things go wrong that don't necessarily need to go wrong. We've heard a lot of examples of that this morning. And I think that a lot of times the issue is a communication gap. And I think that the medium I work in actually has some wonderful tools for filling those gaps. But I want to start at the absolute basics because you're thinking like, wait a minute, we've been talking about really serious things. Why are we using comics? I want to really kind of dispel preconceived notions about comics. This is my definition of a comic. A comic is sequential art that conveys a narrative and often incorporating text. So basically, it's a series of images that may have a few words in them, and our brains, interestingly, work very hard to assemble images next to one another into a story. And a little insider fun thing about comics is that the empty space between the panels in a comic, between the images, is actually called the gap, or the gutter. I'm sorry, the gutter. And the gutter implies time. So you start with a static image, single thing, and as soon as you put one next to it that sort of maybe mirrors it or seems to pair with it, we want to assemble a story. And even just looking at those little 4 simple panels there, you probably are assembling a story about what's going on. You'll notice that when I mentioned this whole slide, I said nothing about superheroes. I said nothing about kids. This is a medium, a creative medium that I think, and I've come to learn over the last 15 years I've been doing this, has incredible possibility in this arena, exactly the things we've been talking about today. And I hope by the end of spending time together, you will agree with me and sort of start thinking about potential for this in the work and the experiences that you're living and having. I thought I'd start with my comics origin story because I think it demonstrates in some ways one example of how this can work. So my original clinical experience as a nurse was during the height of the AIDS crisis in Chicago. And I was a new nurse out of school, and I was really struggling how to deal with the human side for me as a caregiver of everything that we were witnessing at that time. And I'm sure there were a lot of echoes of this during COVID with caregivers. But, you know, I went to a very good nursing school, but they didn't teach us this, right? They talk something about take care of yourself, and it's never really clear what that means. And so I was really struggling to turn to the humanities to figure out there must be something in the arts and the humanities to help me kind of get through this difficult time. And one day, believe it or not, is a straight line from doing this that one day to me being with you here today, that I just drew this picture of myself. And I wrote some words above it just because that's where I was at. And then because I had these words and image separate, I put a box around it. I didn't know anything really about comics at that moment. I was not the kid who grew up reading them very much. I'd read a little bit of underground comics like Linda Barry and cartoonists that I'd liked in kind of daily newspapers, but I was not a comics kid. I also want to point out, I was not the kid at school who could draw. I was told to put my crayons away, my markers away, and to use your words. And I was okay with words, so I left the drawing behind. And that's a piece I think is very unfortunate. I won't get on that soapbox about how we all actually can draw. Hopefully you'll just get it by intuition here. So since I had an image and some words, I just put another thing next to it. And I kept going with this about what had happened the night before in hopes that I would then be able to be present to my patients that evening on my shift and not carry with me all of this grief I was carrying. And rather than take you through the 9 panels that this comic sort of developed into, I want to take this to the abstract and show you what happened for me that day. I started here, and as I moved in image and text through these panels, just writing a little, drawing a little, drawing a little, writing a little, kind of like call and response, I found myself here. And that kind of blew my mind. And I was like, oh, wow, well, this works. And it was the best coping kind of plan I found for what I was dealing with. And so I just kept making comics. And I don't expect you to read these, but these are some real early comics I made about reflect. They weren't made for anyone else to read them. They were made for me to just use this as a medium and an experience and a way to get through what I was going through. You can see the first one there was about, again, I don't want you to read it, but it was about a situation where I wasn't sure I made the right decision with the patient. The other 2 were about bridging kind of life on the unit where everything was really challenging, and off the unit where it wasn't, but I still wanted to reflect on what did I learn in that place and in that time that helped me kind of carry through the rest of my life. I've made comics about my own struggles with health issues, certainly about caregiving my elderly family members. I even made some comics during COVID about, things that we hope don't come back after COVID. But just it's clearly has been a way to navigate the world. And I think that, at anything, I hope you take something away from this, but mostly that combining image and text, because different things are happening in our brains when we draw, even if we use stick figures, even if we feel like we aren't good at drawing or can't draw, it's still actually doing important work. And so the field I work in is called graphic medicine. And this has exploded in the last 10 years when a number of people kind of came together and put a stake in the ground and said, we think comics actually can do serious work in healthcare. And this is my colleague, Ian Williams. He's in England. He's a cartoonist and a physician. And he coined this term, graphic medicine, to refer to the interface between the medium of comics and the discourse of health, illness, disability, and caregiving. And of course, the sort of on a theoretical side, of course, the graphic medicine movement is very kind of rooted and echoed in the narrative medicine movement, which you might be familiar with, which really focuses on the role of stories in healthcare. We absolutely are doing that same thing, but we're just bringing this medium of comics to that service and the use of images. So this is a book that came out in, I think, 2006, really rocked my world and changed the possibility of what I thought those little comics I was making at home could do in healthcare. This is what made me take it seriously. And I want to show you a little bit, just a small passage from inside this book to help you sort of see what I was getting from it. So this is how this whole book started. The guy who created it, Brian Feast, had gone with his mom to chemo, and he was a science writer, and he brought some work with him. And when he finished, he was also an artist. He sat and he just sort of sketched his mom. And now this is a more sophisticated version of that sketch, but he just sort of sketched his mom in the chair with her consent and got, just sort of like annotated it. And he sort of realized in doing this, the balance between science and culture, science and the things that are important to her, science and her family, her society. All these things were all balanced in the experience of being his mom with cancer. And so this prompted him to do this book with his family's involvement. Started as an online web comic that got a huge following and then was published as a book. And I want to show you a section from this book. This is a section from the book called The Usual Unusual. And Brian says, at every visit, the docs always say, call immediately if you notice anything unusual. This simple order turns out to be surprisingly hard to follow. This is Mom, the patient. I have a headache. Yeah, don't worry about it. Oh, okay. On a visit, I had a deep cough. What? You should have called at once. Oh. Again, I feel weird stingers in my head. That's normal with a brain tumor. Oh, okay. In the office, I had a leg cramp. That could be a deadly blood clot. Why didn't you call? Sorry. Mom calls again. I can't breathe. So you have lung cancer. What did you expect? Right. She's wrong when she's complaining, and she's wrong when she doesn't. Either way, she feels stupid. How am I supposed to know? After a while, she stops trying. The reason I showed you this excerpt from Mom's Cancer is that I think it really is a perfect encapsulation of the power of this kind of work to share the window into care that we may not really put together. We might not have that perspective, right? And I had this insight of, wait a minute, if I could use this to share it with doctors and medical students and nursing students and people who can't get these many windows of perspective into the situation, maybe no one caregiver in that path meant to be doing harm, but what we see from the son's perspective is that put it all together, this is the patient and family's experience, and maybe we could be more careful about these kinds of things, right? So I just thought this is a great example of one of the ways these works. And I also wanted you to see the way in which these are not kids' books. These are books by adults for adults living with those experiences. Brian said about creating this book, comics were the right medium for the story I wanted to tell. They meld words and pictures to convey an idea with more economy and grace than either could alone. A comic takes reality and pares away everything that's unnecessary until you get to the heart of that experience. And that's really true, and that's really powerful and important in the environment that we're speaking of, right? And I just want to stress, so this is one of the books that some colleagues that came together created called Graphic Medicine Manifesto. And I want to use a panel from that book to show you why I advocate for graphic medicine mostly, is because I truly believe that those best positioned to represent illness and caregiving are those living with it. And that's in Latin there, these slogan of the disability rights movement, nothing about us without us. And as a family member of someone who with chronic strokes, elderly parents who've just been on all sides of the clinical encounter as the caregiver and as the family member, this is critically important. And unfortunately, though, the history of healthcare is not really oriented this way, right? And one of the things I love about MPAF is that that's exactly where this work is coming from. The history of medicine is that doctors tell us what a disease is and nurses tell us what to do about it. And that's a patriarchal system that's not really good for anyone. That really the patients and families are the authorities on what's best for their life and their body and their community and their family and all of those things. And we should be listening to the voices of these patients and families. And the cool thing about these graphic memoirs, they're actually called graphic pathographies, and I'm going to share more with you, is that this is a great opportunity for us to sort of listen to that voice and elevate those voices. So here's an example from a book called Cancer Vixen. What the creator, Marcella Acocella Marchetto, is able to do here is sort of show the notion of this idea of this metaphor that cancer is growing around me, even though, and it's in the air around me, it's now a part of my life. This image is representing the day she was given her diagnosis, even though, life goes on, right? We have to order dinner. Let's just move on. But of course, this is kind of this part of her life. And she's able to use this medium to do this interesting work to sort of communicate what that's like. Another example, this is a book by Peter Dunlap Scholl called My Degeneration. And this image represents the day he was diagnosed with Parkinson's for him. It's a wonderful book about his experience living with Parkinson's. And again, this is him telling us what this was really like for him as a patient. And this is the cover of that wonderful book. And again, as I mentioned, these books that are by people living with illness and caregiving for adults, by adults, have been given this term graphic pathographies. It's just a fancy way to give them a term for people to take them more seriously. But the reality is they're comics, right? And so this field has exploded. Here are 8 examples just about reproduction. They're trying to get pregnant, being pregnant, inability to get pregnant, perinatal loss, postpartum depression, things like that. This field has exploded. And I'd like to stress here before I go further, not just in English. So we have a website, graphicmedicine.org, which I'll share that link later. There's also Medicina Grafica, which is a Spanish language version. There's a Japan Graphic Medicine Association, which is Italian. This has become crazy enough in the last 10 years, a worldwide phenomenon of realizing the power of comics in this arena. But moving along, these are 4 books about people living with Alzheimer's by their caregivers. Again, all nonfiction. Here are more about cancer. There are quite a number of them about different kinds of cancer. These are about mental health issues, struggling with things like bipolar disorder, anxiety, PTSD. Again, just very few examples of what's out there. There are also things in the graphic medicine, considered in this umbrella, things not just that in the clinic or the hospitals, but of course, things that happen in society, anything that impacts physical and mental health. And of course, structural racism, police brutality, bullying, war, migration, things that impact, of course, physical and mental health, and even things like climate change. There's lots of work that represent all of those areas. Before I go any further, I want us to sort of stop in light of what I've just talked about and sort of think about this in a personal way. And so I would like us to gather a few supplies, even if you just have a pen or pencil. That's a wonderful thing about this field. There's a very low bar of entry, which I find really exciting, for it to do the work that might be of benefit to you. Whether or not you choose to share this with family and friends is irrelevant. What matters is the work that it's doing for you. And so I thought we could start with something a little bit fun. So this is a graphic memoir I did called Taking Turns, Stories from HIV/AIDS Care Unit 371, which was where I worked as a nurse. To do this book and to do it in comic form, I had to create sort of what we call an avatar of myself. And I decided I would make mine somewhat representational, some human shaped, right? But that's the kind of fun thing about comics, is that we transcend all registers. We can transcend time, we can transcend space, reality, all of that. So you could actually have an avatar that is a rock. This rock could have incredible adventures. You would read potentially an interesting graphic novel about this rock. Also a flower, a tree, a truck, anything can be an avatar for how you want to work in your comic. Stick figures work wonderfully. As you see from this example, stick figures can actually be pretty expressive. There's a cartoonist named Ivan Brunetti, and this is another cartoonist using his style, says that basic geometric shapes work pretty well. Linda Berry says that, you can't do that much as a stick figure. You probably could do a little more if you just added some fun to it. So what I sort of want to put out to you to think about as we continue, as I continue talking and as we continue thinking and working together is, what would be your comic avatar? If you were going to make a story about how your average day, using this as a tool, how would you draw yourself? And you're not limited to one. There could be a million different ones. But feel free to drop in the chat some ideas. But also, I'd love to have you take pen and pencil or crayon. I love using crayons. My chapter in the Graphic Medicine Manifesto is called The Crayon Revolution, because I think if we all went back to using crayons, we could do some important, wonderful work together. And you'll see examples of that. So I've created, since we're such a large group and we can't individually kind of share these wonderful ideas together, I've created something on a website called Padlet. And I'm going to share the link in the chat, and I'll share it now and later. And there's also, I'll share in a minute, a QR code if you are good with doing those. But it's a Padlet. And basically, if you see in the bottom corner there, that little plus sign, you can, this is a private, just to the people who have the link that you'll have. It's not public facing. But if you want to share your drawing of your avatar, you just press this little button and upload an image, upload the photo. You also can upload links. And after this talk, I will be uploading some more links of anything you ask about in the questions that you want links to, or anything that I think might be relevant for you to have this as a resource. So this will live out in the world after we're done. And this is the QR code that I mentioned. If you want to take a quick snap of that, I'll bring this back later, so don't worry if you don't have your phone nearby. And again, we'll have the link in the chat, which it already is. All right, the link is in the chat. Fabulous. Thank you. So in talking more about, we're going to have one more interactive exercise in a minute, but in talking about graphic medicine in this field, I wanted to throw out enough stuff that I think resonates with some of the things that have been talked about already today that hopefully you will pick up and figure out ways to, again, make use of in your work and in your way of kind of giving and receiving care. And so I wanted to talk about 4 ways that I see comics being used in healthcare today. And this is a quick overview. I could give a full lecture on each of these 4 areas because, as I said, this field is exploding and it's very exciting. But the 4 areas are education, reflection, research, and activism. So let's take a look at education and comics, first of all, which probably doesn't come as a surprise. There's a long history of comics being used in public health, particularly in crisis, such as war or pandemic. And comics are actually great teachers, especially when there is a high density of information, a high level of importance to that information, and the learner is in a high stress situation. So if you think about, getting a diagnosis or even just having to learn, a lot of stuff in a school program, right? There's a lot to learn. It's really important that you understand it because you're going to have to make decisions based on what you're learning, but you're also stressed out. And we know that people under stress have a difficulty absorbing new information, right? And so comics are actually a great medium to do this work. And the classic example that you'll see, of course, is this, right? When you're on an airplane, this is a comic, right? It shows over time what needs to be done. The learner is very stressed. It's important that you need to know what to do. And there's a lot to learn, right? So that makes sense that this would be what we would use. And also potentially comics can transcend language barriers and literacy challenges. And they add this visual attraction and appeal to receiving information, right? And of course, the other reason comics are frequently used in public health, as I've come to understand it, they're low cost and low tech. I did a lot of research around the AIDS crisis and comics that were used during the AIDS crisis. And what I was told by the National Library of Medicine is we don't even archive all of this because probably every health department used and had made a comic to help teach how not to transmit AIDS, how to deal with whatever, how to deal with any of the side effects or whatever, all the information that needed to go on during that time. And this happened again during COVID, and we archived a lot of it on the graphic medicine website. It's low cost, low tech, and immediate, especially now in the day of the internet. So one example, this is a great doc in the Chicagoland area named Alex Thomas, and he's a pediatric allergist. And when he was a kid, he had asthma. And he couldn't figure out which was his immediate relief inhaler and which was his long-term care inhaler that he's supposed to be using once a day versus in an emergency. And in an emergency, you need to know quickly which one's which, right? And there wasn't really any like uniform packaging or uniform labeling, like literally right on the inhaler thing. And so he created characters that he, as a little kid, drew for himself, and he put them and taped them to his inhalers. As an adult, it turns out he's actually a great cartoonist as well. He grew up and he created this whole educational series called Iggy and the Inhalers. And you can see there in the front, the little cowboy character is Bronco, the bronchodilator. And up in the front there is Coltron, the controller. And then these are sort of the triggers of asthma. And this actually is an incredibly surprising, this is aimed at kids, surprisingly effective way of teaching kids some pretty sophisticated understanding of the pharmacokinetics of their medication through using these wonderful comic characters and the metaphors that they are using there. But I said comics are not just for kids. Through his company Booster Shot Media, he and his partner Gary Ashwall, who's a specialist in health education, have actually made some pretty sophisticated adult comics about informed consent, decision making, and cancer therapy. And you can go on their website, Booster Shot Comics, to learn more about their wonderful work. But that's just one example of the way comics are being used in healthcare. There are a lot of pilot projects, and of course, our healthcare is research-based, and so it's not just fun to be enthusiastic about this. We want to make sure we're doing research to make sure that these are being used in the best way possible and develop our best practices and make sure they're done well. And involving the patient population that perhaps is depicted, all that good, important, ethical stuff around research and making these educational interventions. But there's a lot going on out there. So that's just one example. The next area that comics are being used in healthcare I want to talk about is reflection. So This is a book by a colleague of mine named Andrea Czerwiec, and she's a painter and educational. She has a PhD in education, and she's very convinced that drawing is a way of thinking. And she says here, drawing is a way of constructing ideas and observations as much as it is a means of expressing them. When we are not ready or able to put our thoughts into words, we can sometimes put them down in arrangements of lines and marks. And I think that's a big part of why, even from that first comic I made, drawing is important to me in conjunction with text, right? And so if you think about it in this arena, maybe we're struggling with a decision, we're struggling with our options, and sometimes drawing around that can actually take us to places than just talking out loud with our family and friends or writing text alone could take us. And so here's an example of how I try to utilize the power of drawing in mostly crayons. Is that when I teach, so this is teaching first-year medical students who are really struggling with having to sort of impersonate doctors in the clinics when they know they're not really doctors, but going in and taking a history. And so I ask them in their health humanities elective that I teach, draw a clinical encounter. And I say that very vaguely, right? I don't tell them like in which this happened or whatever. I say this vague prompt for a couple of reasons, because sometimes what comes up for them is they actually draw a clinical situation they were in with families. So they're not the provider. They're actually on the other side of the stethoscope and they're the family member or the patient. But a lot of times they are the provider or this new kind of role they're trying to take on. And we have really powerful conversations around what comes up with them just drawing these with crayons. So she's chosen the sort of cinematic perspective of letting us see through her eyes as she sort of draws this idea of walking into a room and meeting a patient, feeling pressured by time and the exam, which is a little box in the corner, knowing she has to do a full physical exam, and what is going on, just full of questions, right? And so this is the perspective this person chose and the way in which she chose to do it. Another example, it's a little hard to see, and this kind of image comes up a lot where the patient feels very large and the provider feels very small, and they feel like they want to be able to be there for their patients, but their knowledge is so limited, right? Another example from a medical student, is how the things that are happening outside of their encounter, you can see what they're trying to draw there is the partnership between them and the patient, those hands coming together, and in the center is the encounter. The things outside of the clinical encounter that are so impacting this time that the two people spend alone in that room. And we talked about some of this earlier today. Another thing that comes up a lot is the idea of speaking on different registers. So you have the provider there thinking with all of their abbreviations and the information that medical student is sent into that room and charged to get. And the person there with the head injury is talking about in sort of in this dynamic way, not even using words, just describing this image of falling on the stairs, and that's how they got their head injury. So I find it really interesting that this comes up a lot, this miscommunication. Here's another example of the doctor, the would-be doctor saying, like, I feel like I'm talking in XYZ, and the patient is telling me ABC, and there's this disconnect. And so these communication barriers come up frequently in these young people who want to do best for their patients. And so just doing these simple drawings in crayons, we can have these wonderful conversations about what this is like. And then taking it one more step. So I then have them take that single panel. And I'm telling you this because I think this is a fun way to approach thinking about something that you might be struggling with or want to explore using this little crazy tool I'm talking about. And I want you to draw from there what came before. And interestingly, when I have my students do this, they draw what came before. Often they draw what they were struggling with, maybe, 25 beeper calls and 300 demands by their attending physician. But sometimes they switch roles and they draw that the patient had been sitting in that room for 45 minutes before they came in. And perhaps that's why they felt like the encounter didn't go well. And so in drawing what came before, we start understanding the context of the situation that we were struggling with and they were drawing about. And then I have them draw what came after that initial drawing. And often, again, they'll switch registers and maybe they'll draw that patient going home and trying to explain to their spouse what the doctor told them and realize that maybe they weren't very clear and the person maybe didn't really communicate what they wanted to. Or they draw themselves coming out of it and asking all these questions. Did I do this right? Did I do that right? Because what came after actually gives you insight into the consequences of that initial moment, right? So this is just by switching time registers like this is another really interesting thing that comics can do. I want to throw this out and I'll put a screenshot of this, so don't worry about writing all this down when I'm done. But here's a wonderful way that I like to use comics to think about just about any issue, but particular to this situation. We talked, one of the narrators in the video talked about like feeling like you got out of the visit and you didn't even get the questions answered that you wanted, right? And so I think it would be interesting to use a method like this, like at that doctor visit tomorrow, I want to ask about, and then maybe draw some images of things that correspond to that. And this is important because when I leave the doctor visit, I hope to know, because then, and again, you can see the way that the work of the gutter is moving things forward with just contemplating this whole idea of a doctor visit. And again, I'll put a screenshot of this on our joint Padlet, so you'll have it if you're interested. But I thought an interactive thing for us to do, and this is where I'm going to have you use the chat. We're going to use this cascade of responses in the chat. And so this is a 6-panel sequence, actually it's 7 panels there, from a book by The Infinite Weight by this cartoonist named Julia Wirtz. And it's basically, I use it as an example of someone having an encounter with a physician. And what I want us to do is to take a look at this, and I'm going to ask you, you'll see that I've taken out the original text from this visit. I'm going to ask you to, in the chat, drop in a few things that might be in the speech bubbles, okay? So starting with this first one here, we have a physician walking in to a patient who's been waiting and says something. And don't do it just yet, because we'll zoom in on each panel. Then the physician says something else and the patient responds. Then the physician says a lot of something again, and is handing, if you look at their hands here, you'll see this close up later, he's handing the patient a bottle of pills. The patient says something about that, thinks something about that. Patient takes a second, or the doctor takes a second, sort of thinks about that, and says something in response. Okay, so let's take this panel by panel. What I'd love for you to do in the chat is drop into the chat what you think perhaps a physician might be saying when they walk into a room with a patient. Based on, think about the visual, look at the body language of the patient, look at the facial expression, look at the facial expressions of the doctor. What kind of things do you think a doctor could say when they walk into a room like this? Nice. Sorry to keep you waiting so long. Thank you, Sarah. That's great. Yes, absolutely. That's a very nice and sensitive thing to say. Yeah. Excellent. Yeah. What brings you here today? Yeah. Yeah. What brings you in? Good. Good. So an opening salvo. How are you feeling today? So asking about their well-being. Good. Tell me what brought you in today. Yeah. Yeah. So usually that's kind of an opening. I like that. Just kind of cutting to the chase. From Wanda. Hi, Jane. Your test results came back positive. Let's talk. Nice. How are you today? Again, inquiring. Never a greeting, though. Never a greeting. That's interesting. I see here you are experiencing. Yeah, so having reviewed the chart, I've already looked at this, jump to the chase. I see you're experiencing XYZ. Thank you, Tracy. Good, good. Okay, so that kind of covers, I think, some of the things there. Let's move on to the next panel. So the doctor continues talking. Based on those things you said the first time, what might the doctor be saying next? And Tracy, yours still applies there. I see you're experiencing XYZ. What else? And so it seems like that the patient responds, again, look at that facial expression, right? There's so many interesting things you can do with facial expressions in this very simple medium. But the patient will respond to whatever the doctor says there. What do you think the doctor might be saying there? I want to order tests and these medicines for you. Let's figure out what's been bothering you. Good. Thank you. What's going on? Anything since your last visit? Good. 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 I received your test results. Good. I have concerns. Yes. Can you tell me more about how you're feeling? Good. So I received your test results. Yeah. Yeah. So kind of cutting to the chase there again. How long has it been going on? Good. I see a prior diagnosis of. Good. Your NABs were negative for XYZ. Yeah. Great. Great. And then in that context, then what do you think the patient is saying back? Feel free to use, I don't know. Yeah. But I'm still experiencing, I don't know, but I'm still experiencing symptoms. I've not been feeling well. I'm worried. What are my options here? Good. I don't understand. I still don't understand, or you still don't understand. I love it. That's great. Yeah, bringing in some of that stuff we talked about earlier. I've not been. Can you explain the labs in detail? Very good. Very good. No one seems answers. I'm over it. I'm really concerned. I've not felt this way before. Am I contagious? Yeah, good, good, good. The meds make me feel worse. Yeah, I love that. Thank you. Good. What does that mean for me? Yeah. So you've given me information. What does that mean for my daily life? Excellent. 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 All right, let's move on to the next panel. Next panel, we have the doctor then, I'm beginning to worry that no one understands on that last one. Thank you, Vanessa. A pretty, looks like lengthy, says a lot in response. Now feel free to respond to the thing that you put in the chat or any of it. So the doctor responds. I think this is to the previous one where the patient says, can you please give me a simple explanation as to what may going on with me? Good. Thank you, Lisa. Thank you. Okay, so then all that's been said or asked by the patient, the clinician is responding. I shouldn't say physician necessarily. It could be a nurse practitioner, of course. We can start by doing this and then try that. There are several medications you can try. Have you taken this antibiotic before? Good. Good. You're anticipating that next panel there, Wanda. Thank you. Remember, that gives a list of different options. Yeah. I'm sorry, expresses empathy. I'm sorry this is frustrating. I'm sorry you have to deal with this, experiencing this. Yes. We've tried this and that, which is the usual treatment. Maybe we could try something else. Very good. Thank you, Tracy. That's great. That's great. Let's explore our options. I understand you live in a food desert area, meaning that you do not have easy access to healthy food, and you also lack sidewalks. And it appears your A1C at a level we should talk about your options, your preferences. So really tuning into important things. Thank you. I understand this has been a worry for you, but let's see what your options are. We'll go at a pace that you understand and makes you feel comfortable. Excellent, excellent, excellent. All this is very exciting. So that we've got that panel. One of you anticipated it, handing off a med. May I have something in writing to read as a patient saying that? That's great. That's wonderful. These labs mean blah, blah, blah. I suggest you take these options, but you're in control. It's your choice. I want to ensure you know everything in detail before making a decision. Excellent. There are a lot of viruses going on. I'm not too concerned. Probably some antibiotics can help. Great, great, great. So yeah, handing off that medicine. Excellent. There's a lot of responses here that really are showing that you're reflecting a lot of what we talked about this morning with asking questions and things like that. So now the patient's responding. The patient is responding either verbally and in their thoughts, right? So this is really interesting. Your TSH is low. This is the physician again. Nice. Here's a prescription that might be able to address it. Good. Good. I think it's really interesting that in comics, we have access both to what people say, which is a speech bubble, and what they're thinking. And I think in healthcare, you can imagine all kinds of interesting things that happen in that difference, right? People say like, okay, thank you, but really they're thinking, I don't even know if I can afford these. I don't know if I can take these. I don't know if these are going to make me sick, right? So what are some of the things that what I'd love to show here is the conflict that sometimes comes up. Patient thinks, why do I need yet one more pill? Good. Yeah, thinking, how do I take this? How often? Thinking, how much will this cost? What will it really do to me? Great, great, great. I wonder if these meds will make me sicker. I'm so tired of feeling like an experiment. How long will I need to take this before I can feel better? Right? Okay, thanks. I don't know if I want to take this. Are there any other options? Excellent. Will this medicine bother or interact with anything I'm taking? Excellent. What are my alternative to meds? Oh no, another pill. Yeah, excellent. Excellent. Exactly. And some of those things, yeah, exactly, might be things that you'd say just thank you or thank you very much. And you're thinking, oh no, as Lisa says here, not another pill. I'm pregnant. Will this impact my unborn child? Right. And then moving along, we have this sort of beat where the physician sort of takes in whatever the person just said. Nothing else is said. And then the physician says a closing statement. I like that going on the last one there, Elizabeth. Patient says, thank you, this is great. And patient thinks, do I really need this? What is the side effects? Will this conflict with my other meds? Excellent. Yes, excellent. So closing the encounter, we have the last panel here. Okay, then see you soon. Yeah, I like that, Sarah. After the doctor's blank stare, exactly. Okay, then see you soon. If you don't feel better, we can follow up and go from there. Good. Good, good, good. Great. Great. Well, it's interesting. Thank you very much. I'm so cynical today. Sorry. That's great. Take 2 of these and call me in the morning. That's wonderful. This can be inexpensive and a trial medication, and you or we can check and see how much your cost will be. Let me know if there's side effects. So actually attending to some of those concerns that came up. Great. If you were my mother, I would insist you follow these recommendations. Can I bring my daughter with me to help me understand? Good. Good. Thank you. Wonderful. Wonderful. Great. So what I love is that in responding to this, I think that last one, the doctor says, being that we've tried other things, I think you should at least try this and keep me posted. If they're not working, then we could try something else. Very good. So kind of leaving those lines of communication open. Remember, it's your choice and we're here for you, but feel free to use your portal to contact us as soon as possible. Excellent. So yeah, even gesturing towards follow-up care. Excellent. So what's interesting is, as I looked at this, I think that what's wonderful is that I wanted to ask 2 questions, and I think that in your responses, you really reflected both of these. Like, you really reflected maybe what was less than optimal in this visit, but you also, in your responses, from what we, even just listening to what we listened to this morning, talked about how this could go well, how this can go better, how this can go better than sometimes how we often encounter these kinds of things. And so this is another exercise that we use in graphic medicine to sort of look at and think about, how do these encounters go, and how can we use these visuals minus even the text. And what we also do is sometimes when we use this with medical students, for example, if someone fills out this entire page and then we look at the entire pages all together, we can see how widely variant these conversations can be, right? And so that's another interesting way to use these kinds of texts. So I'm going to move along and try to wrap up pretty I see there's still some comments coming. That's great. Great. So I want to wrap up and show you a few more things that hopefully you'll find some relevance in, and try to wrap up on time. So this is a workbook that some colleagues of mine, particularly Michael J. Green, who is a doctor at Penn State in Hershey, and he's been very active in the graphic medicine movement as one of the co-founders with myself and some other colleagues. And they worked with a group called Project Talk. And they created a workbook, kind of a zine, if you know what zines are, but basically like simple paper folded in a workbook that uses drawing and illustration, but leaves room for people to use this as a reflective tool. And so this was done in conjunction with social workers and other care providers to help people prepare for conversations with families in the ICU. So these are basically conversation prep books for family meetings in the ICU. And so people get these in advance, and they're allowed to sort of have some time to really sort of use this as a reflective tool. I'm only going to show you a few of the pages from within this that I think are most relevant and interesting. So they're actually given a piece of paper that asks them to write down a few things that, as either the family member or the patient, that they understand about the current medical situation. And so again, this kind of opens up this space, not just necessarily even just in the moment of that meeting, but kind of like giving people some prompts for preparing for that, so they can then turn to it if maybe in the meeting they get really nervous or they forget. I've gone into doctor's appointments with lists of things, and then the conversation is so variant, I've really lost track of it. And so these are fun ways to keep to have these things. Another example that I think is really helpful in these ICU moments, of course, is what is worrying you the most. And again, the hope is that in the meeting that people share these things. And even just writing these things down, I think, is helpful for the person using this to reflect, to help them kind of bring to the fore and make them realize, oh, wow, this whole time what I've really been worried about is X, and I've talked more about Y, right? They even ask in one of the pages here for a chance to give feedback to how the medical team is doing, right? So is the care you're getting the best? Is it somewhere in the middle, or is it just really just horrible? Are you upset? And then gives them a chance to say more. And then gets to this question around that I think we talk about a lot in ICUs, but not just even, it's so incredibly important as we make any kind of decision. To make good decision, it can be helpful to think about your values. What is most important to your family member or friend? This is for family members of people who are in the ICU. again, kind of focusing on the areas that really zero in on what our values. And understanding our values, of course, is a step towards really understanding how to make decisions and what our choices are. And then they ask about decision-making process, right? Let's talk about how you and your family make decisions. How do you usually make difficult decisions, right? Thinking again, reflecting on this gives us an opportunity to kind of get closer to kind of how to help make a decision. And then I want to talk about two more registers, and I'm going to wrap up. Is that so? That's the reflection piece. I wanted to share that. Research and activism. These are going to be quick. So comics are being used in research to. This was a comic that I made for a University of Chicago clinic where the patients were saying that they felt that the computer was really interfering with the clinical encounter, and so they. Were given this flyer in the waiting room and let them know, by the way, you know, you have the right to ask to see the screen. You can become involved, right? So the patient is saying, hey, I don't take that medicine anymore. And the doctor says, okay, let's fix that record. And that they also have the right to say, can we step away from the computer? And so the family members and patients were given these little cards that had this comic printed out in the waiting room. And then a few weeks later, they were called to ask if they remembered any of that. And this research that was published in this journal said that they did. And actually 3 out of 5 people could remember one of those 3 things. And they actually felt the comic did empower them to be more active in their care. So that's one of the ways I mentioned earlier that comics can be used as an intervention, but we need to make sure these are actually effective and done well. And then the last piece I just want to talk about is activism. I think that it's really powerful because comics can bring the personal narrative and the research can bring data. And when you bring those things together and you realize that what we think of as maybe an individual's problem is actually a systemic issue, and we've talked about a lot of systemic issues today, you can use this medium as a way to communicate that and do some powerful activist work. So here's a great comic by a cartoonist named Aubrey Hirsch called Medicine's Women Problem. And she starts with this struggle of herself in high school or in college, rather, losing weight, going to see doctor after doctor. This is just a simple snapshot of the first panels. And in the course of this, she comes to realize that actually this is a systemic issue. She brings in data. She's got footnotes. It's incredible. And this is another cartoonist named Whit Taylor, who is pregnant, and she's also a health professional. I'm sorry, a public health professional and a cartoonist. And so she made a wonderful comic that I can put a link on the Padlet to this comic about the issue of health, the specific issue of maternal mortality in the African American community. And so this is a wonderful comic that again pairs her personal concerns with data around this. And then she uses the story of Serena Williams, as you see here. So I think that comics are a great tool for that. And I think I can get close to wrapping up. To summarize, I want to say that reading and drawing comics can be powerful tools for caring for our health. The medium is also useful for teaching and learning, thinking and planning, and researching and advocating. And for more information and ideas, you can go to graphicmedicine.org, which is our website. My website is comicnurse.com, and you can contact me directly there. And I have made our workshop Padlet. There is our QR code if you want to get that, but the link is also in the chat. Thank you very much. And I welcome back Gwen Darien.
Thank you, MK. That was just fantastic. And the last thing I shared about the work that you did with Lolita Al-Qureshi was work that she and I presented on in a presentation, and it was so exciting to see what happened and how it really increased people's feelings about comfort and access and taking ownership over their healthcare. And I think through the years, people have felt that computers were distancing, but you showed how they could be empowering, and that kind of interaction could be empowering. And so the whole notion of drawing, and we've done a couple workshops with MK, they've been fantastic, but the whole notion about drawing and thinking and expressing as a way to empower and really articulate your choices, your values, your desires, is a really powerful way of communicating. And I hope that people will take the opportunity to collaborate on the Padlet, and that Padlet will be up for a while.